Hi, I'm Carrie, the nurse with Home Instead Senior Care. Today I'm going to discuss long-term care documentation, what types of assist you may be doing as a caregiver, and making sure you are checking the right box, documenting what type of assist you did. So there is basically supervision for safety. It could be indirect or direct. So let's say your client is an elopement risk or wants to leave the home. You need to know where that client is. So you are providing assist. So you do need to check that box, supervision for safety. If it's indirect, you know they're not going to leave the home, but you need to make sure they're okay. You could be in a different room and they could be in a different room and you check on them periodically. That is indirect supervision assist. Also, a standby assist. So you need to be within arm's reach to intervene. Let's say they're toileting. You can't be down the hallway doing laundry. You need to be outside of the bathroom door, ready to assist if needed, or standing just inside the bathroom door, depending on the size of the bathroom. Also, verbal prompts or cues. They may not know how to brush their teeth to get dressed. So you need to provide short, one-step, precise directions. For example, brush your teeth, and then give a visual brushing their teeth. Stand up, turn here. Hands-on assist, so you are providing what it says, hands-on assist. Maybe with going from sitting to standing, while they're walking, getting off the toilet, or from standing to sitting. So make sure you are checking the appropriate boxes for the long-term care insurance. You may not think you are providing assist, but if you're doing supervision so that they're safe, that is definitely assist. And again, it's based on the care needs, or also known as ADLs and IADLs. If you're unsure or have questions, please give your local branch a call, and we'd be more than happy to discuss that with you. So have a great day. Thanks for watching.